up to me, gave me flowers, gave me a hug, and asked me if I had any Vicodin.
Jennifer Friend didn't want to go through this again.
And my heart sunk, and I knew what was happening right now.
Friend's sister returned to what those in recovery programs call active illness temporarily, relapse.
I spoke to her on the phone. She was so happy. And I could tell she was a little bit loopy from the pain medicine, but that's the last lucid conversation I had with her.
A couple weeks ago, Friend's sister slipped a disc in her back and ended up in the emergency room. Friend says her sister told the doctor she had abused morphine before, but they gave her medicine for the pain and sent her home.
So the physicians, if you have somebody inpatient who is going to be discharged, please discharge to an addicted person who's had the narcotic reintroduced to their system.
16 years ago, Friend's sister was in a rollover crash and injured her back and neck. The doctors gave her morphine tablets to take home. She ended up addicted for 14 years.
We got new people coming in all the time that are in need of support. We have, unfortunately, attend way too many funerals every year.
Kyle Hanshaw is a coach for Peer 360 Recovery Alliance, a nonprofit support group. He said he's seen this situation before. There are some programs that are working with med students to prevent it, but not enough.
It is something that we've kind of known to be an issue in the past, is doctors and other medical professionals kind of not being as educated on the opiate epidemic as we would like them to be.
Hanshaw himself is in long-term recovery, 9 years sober. He said he just needed someone to understand. Friend is now learning that same lesson.
So for years, I just was angry with her, and we were just tore apart. It tore everything apart. There are no, I don't know if her son will ever speak to her again. I don't know.
Friend said her sister was amazing when she was in recovery, helping everyone out. Now, she hopes the healthcare system adds more addiction centers and prevents people like her sister from falling through the cracks in the first place.
The effects of this have lasted a lifetime, so it's very devastating to a family.
Right now, Tina's in withdrawal, sitting in the Gratiot County Jail behind me. She's being held on domestic violence charges, something Jennifer says is all because of the drugs. It's all Jennifer can do to not think about the pain her sister is in. Reporting in Gratiot County, Trevor Sahaki, WNEM TV5.
Now, we did reach out to the hospital. They tell TV5 they cannot comment on the treatment of patients. And as for Friend's sister, she's scheduled for a probable cause conference on June 9th.